Good day and welcome to the Senior Moment. This is Connie Clark with Home Helpers. And this afternoon in the studio, I have Dr. Amy Spoelstra. She is a chiropractor in Coeur d'Alene. And if you read the Coeur d'Alene Press, you will see various articles in there that she does pertaining to our overall health. She is a fantastic resource for our area, and I welcome you.
Thank you. Thanks for having me.
Well, first off, people call you Dr. Amy.
Yes.
So I'm just going to say that, okay?
Yes.
How long have you been practicing here?
I've been practicing here about 5 years. My husband and I moved from South Carolina, and we're both originally from Michigan. We've had our practice, Spoelstra Family Chiropractic, for just about 5 years now.
And you've grown tremendously. I've seen you move from one location to the next. That's very good. I'm very glad. And that's because you treat the whole person.
Yes.
I mean, I've been in there with you, and you treat the whole person. So that when I wanted to talk about chiropractic health, you were the first one that I thought of because you just don't go in and crack our bones. You're concerned about the entire body and where all those bones are connected in our body. And so I guess tell me, broad-based, why is good chiropractic health good for someone getting older?
Right. Well, it's critical for people of all ages. You know, I specialize in pediatrics, as you know. I'm a pediatric chiropractor, but you know, a pediatric spine, a newborn spine is just as important to take care of as somebody that's 99 or 100 years old. Doesn't matter. We have a spine, we have a nervous system, you know, our entire life. It controls our whole body, and we're going to get into that philosophy here in this next, in this segment, maybe the next. I want to touch base on what you had said before about, you know, it's not just about cracking backs or moving bones or hearing popping noises or whatnot. And for a lot of people, that might be a confusing statement at first, because when you think chiropractic, most people think back pain or headaches.
Right. I threw my back out. My back hurts. Get a crack. And that's the end of it.
Right. And that's a very, very common misconception, Connie. In fact, I used to think that before I knew. You know, you don't know until you know. And what chiropractic is really about is about normal, healthy function and adaptability of the body from day one to the last breath that we take. And what I mean by that is that we need to just think about the body logically for a moment. So, you know, think about what controls our body. What controls the entire body?
Okay.
Our brain, right? Our brain
most of the time.
Always, all the time. I know most of the time. It depends on who you're asking.
Sometimes it's your stomach, but okay.
Yeah, right. Like I get your stomach, or people might say, I give a lot of lectures in the community, and people might say, you know, your heart controls your whole body or whatnot. And then it always comes back to, if someone says your heart, then we say, okay, well, what tells the heart what to beat or when to beat and how hard to beat?
What's
and then
the root cause of all
That's
this?
Right.
Okay.
That's right. So we go back to the brain. You know, the brain controls the entire body. The brain, if we disconnected the brain from the body, if we just disconnected there, took your head right off your body, how well would your body work? It wouldn't. You know, we know that. And the reason is we know that the brain has to get the messages out to the body. And the way it does that is it sends the messages down the spinal cord and out the nerves and tells your body parts what to do. So let's take a step back. We know the brain controls the body. The brain has to get the messages out to the body via the spinal cord and nerves. We know that the skull protects the brain. Well, we also know that the spinal bones, the bones that make up your back or your spinal column, protect the spinal cord and the nerves that carry all those messages, those vital messages, out to your body parts to tell them what to do.
So that's like the telephone lines. Your spinal cord is the telephone lines.
That's right.
Okay.
That's right. And so with that, we know that just as if, you know, a little one or anybody really, any of us, any of you listening, fell down and hurt your skull or cracked your head, we'd be concerned, right? And we would first, of course, want to stop the pain, stop the bleeding. We'd be concerned about that. But the big picture of that is we'd want to make sure that the function was still everything was correct in the brain function, because ultimately the skull is there to protect the brain. That's what we're concerned about. Same thing with your spinal column. We need those messages traveling from the brain to the body parts and back to the brain. If we have a problem with the spinal column, the bones in your spine, it can interfere or block some of those messages from getting out to the body. That's where function comes in. So what I mean by that is if we have what's called a spinal subluxation, it's a misalignment of one of the bones in your spine, it can put pressure on the spinal cord and on the nerves.
That's why your back hurts.
Well, sometimes that can cause pain. See, here's a really, really important point, is that only about 10% of all of the nerves in your body can tell your brain pain, pressure, vibration. They're called sensory nerves you can feel. So if you're having some sort of pain, pressure, numbness, these type of things, I like to call those your check engine light. And you're lucky because there are other 90% of the nerves you can't feel.
Well, what kind of nerves are those?
Good question. Those are what we call your autonomic nerves, your motor nerves. Those are the nerves that control things like your heart. Like we can't feel. You can't feel right now, Connie, if your heart's getting the messages or if your liver is getting the messages.
Okay.
Right? But all that stuff's happening in your body. Your immune system's working because there's lots of different bacteria and viruses going around right now. Your immune system is activated. You might not feel it. You might feel great. But all that stuff's working in you.
And those are all your nerves that are connected to your
right.
spine. Okay.
That's right. That are connected to your brain, sending messages down your spine, your spinal cord, and out the spinal nerves, plugging into the organs and tissues and cells in your body, telling your body parts what to do and when to do it. See, it's amazing. It's what we call innate intelligence in chiropractic, because it's not the educated brain. We don't have to think about activating our immune system, right?
Right.
We don't have to, like, if we
It's
get a
not like
paper
reading.
cut, right?
Okay.
We don't have to activate our educated brain. If we get a paper cut, if you get a paper cut today, you don't have to close down shop at Home Helpers tomorrow and stay home and think about all the millions of things that need to happen in your body in order for that paper cut to heal.
Correct. Okay.
Right? It just happens. You go to work, you think about all the things you need to think about to keep your business running, to help all the people you help, and that paper cut's going to heal. That's innate intelligence. That's all facilitated through your brain creating the messages, sending them down the spinal cord and out the nerves. And that's what we as chiropractors are protecting. We're protecting that flow of information to and from the brain. Biggest misconception is that if you have that interference or a problem in that communication, that you will feel it. We know that that's not true, because only 10% of the nerves in your body are actually built to tell you pain, pressure, vibration. So the rest of them are just doing their job, and you don't feel it until there's a major fire to put out, which is why spinal health, keeping that spine, just like keeping your skull healthy, keeping your teeth healthy, spinal health, keeping your spine healthy is vital. It is foundational for a healthy body.
So your spine could be pressing on nerves that have to do with liver function or something like that, and you wouldn't know it because that nerve doesn't have a feeling attached to it.
That's right.
If that's a good way to say
That's
it.
a really broad stroke, that's a really good way to say it. I mean, we are not aware. I mean, we've all met people that, I like to give this example, Connie, because I think we can all relate to this, is that we're kind of taught in this system, in this medical system, we all have pretty much all been raised this way and have been trained this way, is that, everything's great and fine and dandy and we're healthy unless we feel something, right? If something was wrong, we would feel it. So what we do is we've been conditioned to depend on these feeling nerves to tell us what's going on, to tell us if we're healthy. Well, I like to say, let's think about that for a moment and see if there's any contradictions or flaws in that thinking. So when we look at that and we say, well, first of all, we've all met somebody. We all know somebody who seemed to be in perfectly good health, felt great. Maybe they were out running marathons, maybe they ran 5 miles a day. They just seemed perfect. They weren't overweight. They didn't have high blood pressure or diabetes. And one day they dropped dead of a heart attack.
And we have seen that here in town also.
Right. And it's a really hard thing to think about, and it's a really sad thing to think about. But right there, that shows the major contradictions in this way of thinking of, if I feel well, then I am well. We know that that is not true. There are many things we need to do. We need to look at the function of the body. Is my body functioning? Am I doing what I need to do to make sure that there's nothing blocking the normal flow of information, the normal way that my body is supposed to be working? There's a lot of factors in that. One is we need to make sure, the first thing, the foundation is we need to make sure that that brain to body connection is there, because your liver's not going to work if it's not plugged into the brain.
True.
And then, of course, and we can get into this in more detail, but of course, I call it, that's called neural efficiency, brain to body connection. Make sure that brain is plugged into the body, body to the brain. Next step, I like to describe it like a pyramid. If those of you listening can imagine this kind of drawing, I draw out a pyramid, and the base of the pyramid is that brain to body connection. That's what chiropractors can help you with. We can assess those nerves that we can't feel, and we can measure the function, and we can make sure that we're plugged in there. If we're not, we can help you correct that. The next thing is, hey, what are you putting in your body? Because of course nutrition is important. What you're putting in your body is critical. We need to not put toxins in the body. We need to not put things that cause inflammatory responses in the body. We need to make sure we're getting the right things in the body, nutrition, supplementation in some cases, and everybody's different. And then the next level, if you can imagine, so the base of the pyramid is neural efficiency, or brain-to-body communication. That's where chiropractic comes in. Then we have, what are we doing with, or what are we putting in our body? That's the nutrition. Then the next layer on the pyramid is, what are you doing with your body? Are you moving the body? Of course we know the body's made to move. Exercise, movement, stretching, very, very important. And one of my favorites, the very tip of the pyramid, is positive mental attitude. What we're thinking is so critically important as well. We know that there's a mind-body connection. And so I like to make sure we never leave that one out. And the biggest thing is we need to realize that we need to do things in that order. We wouldn't build a house starting with the roof. We need to make sure that we have a nice, stable, strong foundation. That's that brain to body connection. Then we build our way up.
So, okay, let me give an example, because I do a lot about this. I talk about my family in here and different issues and different things. Example, my husband has high blood pressure.
Okay.
We've cut back all the things that would cause that, the red meat, the salt, the processed foods, all of that. It's still high. Well, we've forgot that bottom layer. Is that what you're saying?
That's very possible. I mean, if you have forgotten that, you must start there first.
Okay.
Yes.
Okay.
And there, by the way, there are a lot of studies, particularly a doctor out of Chicago did some research, a chiropractor, and he partnered with a medical doctor doing some research on blood pressure and chiropractic, and the outcomes were very, very favorable. Actually superior than using blood pressure medication.
And that's what we're trying to avoid.
That's right. There's a reason. See, this is what I'd like you to think about, is that there is a reason why his body has high blood pressure. It's a response. It's an adaptation to some stressor in his body. That's right. And so by taking away that normal adaptation, that might not be the best thing. Sometimes we need that. I'm not against medication or surgery. I just think we know there's a time and a place. And so we must build our house from the foundation up. So what you've done with the blood pressure there is you've taken away, you've started with that second layer of, what am I putting in the body? What am I taking out of the body? And that's wonderful. Many people do that and then get frustrated because, well, what if we never check to see if the brain's plugged in there? Brain getting messages to the body. I don't care what supplements you take or what dietary changes you make or what exercise regimen you start doing. That's still all outside in. If the brain's not, if that master control system of the body is not working efficiently, not going to matter.
Now, I know I've been in your office, and I know you have charts up there that there are different parts of the spinal cord connected to different pieces of the body. And so if someone came in and said, I am having this issue, you would know where to look. Or if someone came in and said, I'm not sure if I'm having any issues. Could you find where in their spine they might be having an issue, and how do you do that?
Good question. That was an old, kind of in the beginning of chiropractic, which was over 100 years ago. They use this kind of nerve mapping type scenario, and we do know that there's certain areas of the spinal nerves where the nerves come off of the spinal cord that go to certain areas of the body. Absolutely, but that's not how we analyze, because you could have what we call a subluxation, which, just a review here, is going back to when we have a misalignment of a bone in the spine that's putting pressure, interfering with normal function of the nerve and the spinal cord at that level, causing misinformation to get out, or decreased information to get out to the body parts and then back to the brain. That's what we call a spinal subluxation. So we can't say specifically based on symptoms, like if somebody comes in and they're having back pain, or somebody comes in and they're having sinus troubles or high blood pressure or ear infections or whatever. First of all, we don't treat any of those things. All we do, we don't say, hey, yeah, chiropractic adjustment cures ear infections or high blood pressure, any of
This
those
part
things.
right here will do it.
Right. It's not that at all, and this is a common misconception. What we do is we look for interference anywhere within that nervous system, that central nervous system, and we say, let's remove the interference and watch the body.
And see how it reacts.
That's right. And, yes, there are a lot of things that respond favorably, but everybody is different,
Okay.
So we can't just go off of, well, this child has ear infections or this person has chronic sinus issues. We can say, hey, yeah, we seem to have, a lot of people do better when we adjust them if we find interference that have this condition. But we're not treating any of those conditions. We're just improving, we're just restoring normal function to the body, because I think we can agree that having any of these disconnects from normal function, high blood pressure, cancer, diabetes, ear infections, vertigo, any of these things are not a normal function. I mean, this isn't a normal state for the body. It is a departure from how the body is supposed to be working. And so all we're after is looking for, well, let's reconnect and make sure that the body is functioning efficiently, and then watch what the body does.
Well, and I can see too, if the issue is at, say, the bottom of your spine, and that nerve goes all the way up. So if there's something at the top of your spine that's pinching that same nerve, then it would be at the top versus at the bottom, if that makes sense.
Well,
No?
it does. I mean, in a way, what we're talking about is what you're saying there, I think, is that everything's connected. And that's true. There's all the bones in the spine, and you could have, if you had a subluxation or a misalignment at the very bottom, it can, cause an issue at the very top.
Well, no, I was talking about the opposite. If the subluxation was at the top,
Yes.
and wherever the nerves were that went out to the body came out at the bottom, that nerve still came from the brain.
Yes.
So it had to pass
That's
through
right.
that.
That's right. So we're looking at the whole system.
Okay.
Absolutely. So something, we could have a subluxation at the first bone in the spine, which is called C1 or atlas, and it could be affecting, something completely, in a totally different area of the body, because, the messages, after all, are coming from the brain.
So it still has
down.
to pass by that
Yeah.
road. Okay.
Yep.
Well, we need to take a break, but I want to continue this conversation because I always learn so much from you. So we will be right back.
Not stupid. Good questions. Good questions.
Get the conversation going.
No, those are good questions, and you know a lot about this topic, so it's helpful.
Okay, so tell me a direction you feel would be a good place to go next.
Well, we did a lot of covering, just the basics there. Am I going to? Sometimes I get in and I'm going too deep into the.
You're doing good. I'm
Okay.
understanding what you're saying.
Okay, good. So I don't know if you want to go over this at all or not, but I specialize now in the neurodevelopmental disorders, working with the ADD, ADHD, autism spectrum, and I do find that a lot of this population, we get a lot of calls from them because of the grandkids, and we get them coming to our informational meetings. It's interesting. It's like 50% of the people that are plugged in are the grandparents that are going, my grandchildren have this issue and I need to know what to do. help them, and they show up to the meetings and they're like a part of the life. And so I don't know, that might play a role. That might be interesting.
Well, let's do that the last
Okay, the last one.
segment.
Yeah.
So, because I do want to filter into that.
Yeah. We could go into this kind of pyramid idea a little bit more and just kind of define each of the areas if you want. And so we could say, okay, what is, okay, this brain to body connection. Well, how do I know if there's a problem if I can't rely on pain? Go into how we can measure that. How do they find somebody to help them with that?
Okay, that's good.
And then go into the nutrition and exercise and positive mental attitude. We could just kind of break down the pyramid.
That's good.
Okay.
That'll work.
Okay.
And we're back. Welcome back to the Senior Moment. This is Connie Clark with Home Helpers, and I have Dr. Amy Spoelstra with me. She is a chiropractor here in Coeur d'Alene, and we've been talking about the importance of good chiropractic health and how the brain at the top of our heads controls all the nerves that come down through our spinal column, and how sometimes when our spine pinches those nerves, it can cause issues. And you had said that only 10% of the nerves in our body tell us pain. So if it's pinching a nerve that isn't a pain nerve, how do we know that? Mm-hmm. What do we do?
Well, that's a great question. And like you said, about 10% of the nerves in your body are what we call sensory nerves. The others are the functional nerves. And so the question is, well, if I can't rely on, like, the contradiction we talked about in the previous segment, let's go into that a little bit, because that leaves us a little bit hopeless, going,
how do we know?
How do I know? What do I do? Yeah, you're right. I have this friend who seemed perfectly healthy, and they were diagnosed with cancer, or, they had a heart attack. And this is a reality. We know that happens all the time. So right there, that shows us there's a flaw in this model, this healthcare model that we've been taught. So let's dig into that. If we can't rely on how we're feeling, we must rely on how we're functioning. So if we start with, I'd like to just go back to the pyramid example. And if everyone can maybe draw this on a piece of paper in front of them. If you're driving, don't do that.
Don't do that,
please.
yes.
Yeah.
Don't do that.
Or just imagine. Use your mind's eye. That's good for the brain. It'll keep you young. But, think about a pyramid, and we're talking about the base of the pyramid being neural efficiency, otherwise known as brain-to-body connection. And we want to make sure that we have that brain-to-body connection. So we can't, these are the basic functional nerves down here. This is the basics of how your body, the foundation and the basics of how your body works. You want your heart to beat, it has to get the messages from the brain. You want your liver to work, you want your immune system to work, it has to get the messages from the brain.
You want your car to run, everything has to be connected properly.
That's right.
Okay.
There you go. And so we have the question of going, okay, can't feel it, how do I know if it's working? That's where your chiropractor can come in and say, okay, well, we've got some tests that we can do to determine what's going on with those functional nerves, okay? We have several different tests that we can do that we look at the ones that we can't feel. One is called heart rate variability. None of these tests hurt.
I was going to say, because the only thing I can think of is an x-ray.
Right.
Well,
let's break that down a little bit. If somebody comes into our office and we're saying, hey, I'm having ADD or ear infections, or I just want to be checked out.
I'm having headaches all the time. Or no, that hurts.
Mm-hmm. Yeah, or nothing. We're talking about here. We don't feel anything wrong. So I just want to make sure that my body's working right. And we get that a lot. In my office, we work with mostly families. And kids don't have these problems. Kids don't have pain. Kids don't have degenerative diseases for the most part. They're not feeling things like this. But we want to make sure that those functional nerves, that brain's plugged into the body. So here's what we do. We have to first look at the foundation, okay? That brain-to-body connection. We go, let's measure it. We can't feel it, we have to measure it. Sure, we pay attention to what they're feeling. If they're feeling something, that's those 10% of the nerves. And then we have a test called heart rate variability. It's just measuring the balance of the way that the autonomic nerves, the autonomic, aka automatic nerves are working in your body. That's about a 7-minute test.
What is that, sort of like an EKG or something like that?
No, heart rate variability is measuring, basically, to make it really simple, the rhythm and timing of your heart. So it's not telling us, we're not looking, sure, we take your resting heart rate, and we do look at that. And so if there's some red flags there, we know to look at that and make a referral if we need to a cardiologist. But heart rate variability is something that cardiologists started using back, I think, in the 70s, and we use it also because it's telling us not just about the heart, it's telling us about what's controlling the heart, the nerves that are telling the heart what to do. So if we think about this for a moment and we say, we all know, let's just think about our own bodies right now and pay attention to our own bodies for a second. We know that our heart is not beating at the same rhythm every single second.
It's not like the second hand of a clock.
It's not. It's not consistent. It speeds up sometimes, it slows down sometimes, and it's fluctuating up and down all the time. That's good. That's healthy adaptability. We're sitting down in chairs right now, Connie. So maybe, our tempo is down, those rest and recovery nerves are going, yeah, we're comfortable right now, we're just sitting back chatting. But if all of a sudden the fire alarm went off, we would get up and we'd run, right?
And our heart rate would increase.
That's right, and the tempo would increase, and we need those nerves to tell the body parts, tell the heart to increase the tempo, to get the blood to different parts of the body so that we have the capability and capacity to get up and run, right?
So would you measure someone resting and then tell them the building's on fire and see if their heart rate goes up or
In
what?
fact, we want them, with this test, heart rate variability, again, we're measuring the normal function of the nerves because these are the nerves that are controlling things in the body, controlling everything. We want them just at rest because what we want to see, we have that. Even just sitting at rest, we have fluctuations, natural fluctuations of that. It's like a dance. We have the speed you up nerves, and then we have the slow you down nerves, and the speed you up and the slow you down, and the speed you up and the slow you down. And we have this dance in a healthy body. We have this normal dance going on up and down all the time. Sometimes, if we're real stimulated, it's going to go way up, and then it's going to come back down to a good set point. But the normal set point is we have this fluctuation. That's healthy adaptability. That's good. So we take this measure and we say, are we way on the speed you up side, which most people are in this society, or are we on the slow you down side, like everything's exhausted and those rest and recovery nerves are just overboard? So we have to take a measure of that. We know that if we find an imbalance in that, research has shown us that if we take care of the spine, decrease pressure on the nerves, that tends to regulate. There's a good correlation there, which is why we incorporate that into our practice, because we use that in the beginning now, and we use it as a re-exam as we go as well.
To see if it made any difference.
We need to see. Do we need to also look at the next layer of the pyramid, which we're going to get into in a minute. So we're still at the base of the pyramid here with neural efficiency. We've got heart rate variability. We have thermal scanning, which is just telling us it's a heat reading on either side of the spine. And what that's telling us is that what's going on with the nerves on either coming out of the spine. So the way that works is that those nerves also control the blood vessels paraspinally or on either side of the spine. So just think about it. When you have dilation of blood vessels, you get more heat. When you have constriction of blood vessels, you get less heat on the skin. And so what we're measuring is we're taking a heat reading on either side of the spine, and we want it to be relatively symmetrical at each level. So like at one bone in your spine, we don't want to see a huge difference from right to left. We know that there's some problem with the way the nerves are working at that area or at that level. So that's why that test is important. Again, we do that in the beginning, and we do that as we go because we need to see what's going on.
So if you saw some that had this one level of heat, and then you found an area that was way lower, then you would know that the blood vessels were constricted at that point because there wasn't as much blood going through.
Yeah, that's what it can tell us. And so we're not as much concerned about, say, the low back compared to the mid back. We're more concerned about at one segment. We take the entire reading on the entire spine, but we're looking segmentally. So at the fifth bone in your spine, at that level, if the left side and the right side are very different, then that tells us that there might be some interference to those nerves that are bringing messages to the blood vessels, which also bring messages to organs and tissues and cells.
So if it was given more to one side, it's given less to the other side.
That's what we're looking for.
Okay.
We're seeing, is there a big difference? Is there a variation from one side to the other? If there is, it doesn't tell us for sure that there is a subluxation there, but it's one of the indicators. There's many different indicators. It's like all these different arrows getting us to the right point, getting on the right bone adjusting it in the right direction, because it's not a guessing game. It's very specific.
Okay.
And so there's that, and there's also something called static electromyography, or SEMG. And what that's telling us is it's a measure of basically like the energy in the muscles on either side of the spine. Again, we're measuring there the motor nerves. We want to know what's going on with the nerves that are taking messages to the muscles. And so how are those muscles responding on either side of the spine? Are they in spasm? Do they have a ton of energy on one side and not on the other? That might tell us something's going on there. So that's just one of the other tests that we do. So that's how we look at that core neurological system. We want to say, hey, we can't depend on how it feels, how we feel. We need to depend on how it's functioning. So that's how we know. We take an assessment with those 3 tests of how it's functioning. Then that's the neurological system. Next, we need to look at, well, what's happening with the bones, right?
And that's the only thing I was thinking of when you were saying, look at the spine. I look at the bones and, okay, are they all even, or are they all going the same way?
Right.
But the other tests you're talking about would pick up minute things that you may not see.
Underlying, which is really what we're after. So we do not have to deduce about what's going on underneath the bones if we see issues with the actual structural spine, but actually we can rely on objective measures of what's going on with that spinal cord nerves. Okay, the autonomic nerves. And so the ones that are controlling things that we can't feel. So we have to take those measures now. We can do that now, so we do that. And it gives us more information. So then we look, of course, at a lot of times we take x-rays because we want to see what's going on with the spine that's protecting the spinal cord and nerve. So we look there. That gives us a lot of information, tells us how to adjust, when to adjust, where to adjust, how long a problem has been there, maybe what the initial problem was. Lots and lots of information. Then the last thing, or another thing that we do, is we look at the muscular layer. So we want to see, well, what's going on with the muscles? Muscles are attached on either side to bone. Just because a muscle's tight does not mean it's a muscular problem. Maybe it's trying to compensate for a misaligned bone. And so we have to look at, how's the body moving? We need to feel that. We need to look at that. We need to look at posture. How's your body? How are you holding your body? And then range of motion. Look, a lot of people, especially as we get older, will see limited range of motion. So inability to completely turn the neck or the low back or the mid back or any part of your body in one direction or the other. And that's a really big check engine light. If you're having those restrictions in range of motion, you need to look at that and say, okay, why is this happening? Look deeper.
That's not normal for you, because a lot of us have seen seniors driving, and they're trying to look behind them, and they can't move their head either way. And that's not normal aging.
That's not normal. No, it's not. And that's actually, it makes me, it's kind of funny a little bit, because that's one of the first things that people say for the adults that come into the practice when we start correcting things. They don't come in saying, oh, I've got restricted range of motion or I can't turn my neck. But one of the first things that they notice is, hey, doc, I can turn my head when I'm backing up in my car.
That's a good thing. That's a good thing.
Yeah. And then I'm like, well, geez, we're making this city a safer place.
Because you see that a lot. Or you see seniors that are hunched over, or the shoulders are slumped.
Yep.
And I guess those are just habit, or is there something in the spine causing it, or because they're always doing that, the spine has adapted, or...
Great question. Really, all of those things.
Okay.
I mean, we don't know until we look. That's the thing. And that area that you're saying kind of slumped over, head pushed forward, we see that a lot. It's called anterior head carriage. That's not just a concern about how we look or how we're feeling or range of motion, inability to turn the head. We're really concerned because those nerves, those bones, the muscles are attached to bones. The bones are protecting the spinal cord and nerves. Those nerves go places, your thyroid, your throat, your vocal cords, your shoulders, your arms, your hands. So we don't know what's going on. We don't know what's causing anything in the body. We don't know what's causing poor posture, restricted range of motion, thyroid problems, ear problems. We don't know any of that stuff, but we do need to look in the right order at the body instead of just throwing medication or surgery and trying to correct things from the outside in. The body works from the inside out. And so we need to start from the inside out.
That makes sense. Because usually when you see people like that, they have internal things going on where they have issues.
That's right.
And those things may be connected.
Absolutely. It's pretty amazing to see what happens when we start correcting these interferences, these subluxations in individuals, whether it's a newborn baby or, an 85-year-old. When we start correcting these subluxations, I like to call it like your lights are being turned on, because it's truly like that. It's like there was a dimmer because all the information wasn't getting through, and you can just see the lights turn on in people and they get their life back. And that's one of the things we get a lot of calls. We get a lot of calls from seniors, actually, and sometimes it's for themselves and sometimes it's for their grandkids, because people know that we're a pediatric practice. But the biggest thing is they just want to have some hope, and they want to know that there's something else out there besides just medicating these problems.
Well, let me ask you something, and I could see this being a concern of a senior. Say, well, I'm old, my bones are brittle, I'm afraid to go to a chiropractor because what if they, correct or pop my back,
right?
And now that breaks.
Right. Good question and a valid concern. Here's the answer to that. All chiropractors are trained in many different techniques and know when it's safe and when it's not safe to adjust. Adjusting is very safe. Chiropractic is very, very safe. I mean, just ask about, and anybody asks about safety of chiropractic, because there's a lot of misconceptions out there about chiropractic. Just ask about the malpractice insurance we pay. It's like nothing. Can I say how much? I mean,
No.
it's nothing. That shows you that, it's less than 1 month's rent
So
for an
it's
entire
not
year.
something to be concerned about.
It's really not, but I understand. I want to address that specific concern, because there are, people think chiropractic, they think of like heavy adjusting.
Yeah, someone
twisting
putting their knees in the
neck.
back,
Yeah. And there are those techniques out there. Some people like those. Some people are really skilled in those techniques. And then there's other techniques out there. Like I said, I'm a pediatric chiropractor. I personally don't do any techniques that involve twisting or twisting of any part of the spine. Those techniques are just fine. But there's different chiropractors that specialize in different things. So when seniors call our office, if it's not a good fit for us because we don't have room in the schedule, or because we do specialize in pediatrics, we have people that we send them to that we know do certain techniques. And one of the things I would just tell people is, hey, ask about the techniques. Ask, do you do gentle techniques? If you're uncomfortable with the twisting or the heavy adjusting, there's things called the activator. It's an adjusting tool. It's very, very gentle. It would be almost impossible to cause a fracture, rib fracture or anything like that. There's other techniques. The drop table is one that I like to use. There's Logan Basic. There's so many different techniques that don't involve any kind of real forceful adjusting. And I don't like to use the word forceful, because even the adjustments that are a little bit heavier are still very good for some people. But all chiropractors are trained. They're all doctors of chiropractic. They've had a lot of education, and they're all trained to know when to use what technique.
So that should be something they shouldn't be concerned about.
Right. But if you are concerned about that, I totally understand that, and just ask, And if you're not getting the answers that make you comfortable, call the next person or call our office and we'll help you. We'll send you somewhere.
Because that is a concern.
Yeah.
My bones are getting brittle.
Certainly.
And the big fear is I fall and break my hip. So why would I put myself in a position to possibly have something break? But
Right.
If there's techniques out there that's not going to happen, then they really need to know that.
That's right. I mean, we check the spines and adjust hours old babies, like 1 hour old, I think is the youngest baby I've checked.
Oh my goodness.
And, we're not twisting.
No, that wouldn't be a good thing.
It takes about the amount of pressure that you would put if you had a rotten tomato. The amount of pressure to push through the skin on a rotten tomato is about the amount of pressure that you use on a baby to adjust.
Wow.
So it's almost nothing. It's just about being on the right bone, going in the
right
direction
place
to turn the lights on in that baby. Yep.
Well, we're going to take a break, but I want to continue talking with you because I know there's a lot of other things that we've talked about during the break that I really want folks to hear. So we will be right back.
Yeah, that's cool, huh?
to talk about the ADD
Mhm.
and all of that. And what I'm going to do is start it out with now. I know you have mentioned that you get a lot of calls from grandparents about their kids
Mhm.
and kind of go into it that way.
Yep.
Okay.
That sounds great.
And we're back. Welcome back to the Senior Moment. This is Connie Clark with Home Helpers. And this afternoon I have Dr. Amy Spoelstra with me. And we've been talking about good chiropractic health and some of the myths and some of the facts that go along with it. And one of the things that we talked about during the break that we hadn't mentioned was you were saying that you have a lot of grandparents that call your office concerned about their grandchildren, the issues that their grandchildren are having. And some of the things that you mentioned, I would not, in my little brain that doesn't know a lot about chiropractic, think had anything to do with chiropractic issues. But in talking, and you said the brain connects everything in the body, then it kind of makes sense. Could you go into details about that? Because it's really interesting.
Sure. I believe what you're referring to is our focus program. And we do get a lot of calls from grandparents. We have a lot of grandparents attending our lectures in this program. This program, what we're doing is we specialize in neurodevelopmental disorders. Now, what that means, neurodevelopmental disorders can look like many different things. Some people have a diagnosis, some children or adults.
I was going to say adults could too.
Adults as well. In fact, in our program, we have about 50% adults, 50% kids, which surprised us because we didn't think there would be as many adults seeking help at this point for these neurodevelopmental disorders, but there are. So what these are is that people might have a diagnosis of ADD, attention deficit disorder, ADHD, attention deficit hyperactivity disorder, which, by the way, you don't have to have the hyperactivity component there. So ADD, ADHD, autism spectrum disorders, Asperger's syndrome, learning disabilities, unexplained lack of productivity, anxieties, particularly social anxieties, inability to really comprehend nonverbal communication and therefore have trouble in social situations. These things are what are classified as neurodevelopmental disorders. And it's really interesting working with this demographic of people because, like we were talking about before, turning the lights on with individuals, you really talk about turning the lights on and helping people have an optimal expression of life. It's this group of people right here, especially autism spectrum disorder. So we do a lot of education in the community on this, and we do have a lot of grandparents that are interested in this topic because they see their grandchildren and their children struggling in school, struggling in, if we're talking about adults, struggling in life, holding down a job, relationship-wise, keeping their marriages together. We see this kind of stuff all the time, every day. With the children, and it's really more that we see the grandparents really coming to learn how they can help their grandchildren.
They're the ones that are seeking some sort of knowledge.
Yeah, I mean, the parents are as well, and we have a lot of people interested in this program. In fact, our program is almost at capacity all the time, and then we graduate people and whatnot. But no, I was really surprised, and I was really happy to see this role that grandparents are playing in this and recognizing, wow, my grandchildren are struggling. They're struggling in school. They're struggling with their behavior, their health, everything. And they want to know why. And also, I really commend this population or this age group because they're the ones really asking the question and going, my grandchild has a problem, and the only opportunity or the only solution they're being given is to medicate with psychostimulant medications. And they're not really buying that. This grandparent this grandparent demographic here is going, no, there's got to be some other solution. And what our program is, Focus Chiropractic is one of the parts in it. I like to call it like a three-legged stool, the program. because there's three really important parts, and one isn't more important than the other. That brain to body connection is critical. The brain's not going to develop appropriately or fully. We call it top up, bottom up development. It's normal neurological development. It's not going to develop appropriately if we don't have that brain to body connection. Okay. So we have to have that there. That's why chiropractic is just a tool to achieve brain to body connection, aka neural efficiency. It's just a tool to achieve that. It's not about the word chiropractic. We love chiropractic because it gives us brain to body connection. So there's that. The second component of the focus program, with working with these individuals with neurodevelopmental disorders, is the nutritional component. It's very important, and specifically a gut healing protocol. We know that. Have you heard, Connie, the gut referred to as the second brain? Have you heard this? Some people have heard this.
I thought I have, but I'm not really sure. It doesn't sound foreign to me.
Okay, you've probably heard it somewhere. Most people have probably kind of, whether they understand it or not.
Well, when I was talking about that your stomach rules, okay.
There you go.
Yeah,
there you
all
go.
right. I'm there.
Right.
All right.
I thought maybe you had that one. That's what I thought when you said that. I thought, or you were hungry.
yeah. Well, that's what I mean. It rules. It says it's hungry. Okay.
So no, the gut is the second brain. We know that. Even the medical associations, they have come out going, yeah, the gut's really important. It's important in total overall body health, in neurological health. And what's going on there is that we know that there is an intimate relationship between improper development or neurodevelopmental disorders, ADD, ADHD, autism spectrum disorders, learning disabilities, these type of things. There is a very intimate relationship between those things, those classifications, and gut health. Okay, and what's going on in the gut. There's something called, this would take a whole nother hour, which we could do, talking about increased permeability in the gut or leaky gut syndrome. Maybe you've heard of that before. But basically what we have to do in the second leg on this three-legged stool in the focus program is we need to look at the nutritional deficiencies and nutritional issues, things that are causing inflammation in the gut and in the brain. We need to look at them, we need to specifically target them, and we need to correct them with these children and adults. And so that's the second part. The third part of this focus program is looking at the strengths and the weaknesses in neurological development, so in their brain development. So, to take a broad stroke on this, we know that we want the brain communicating efficiently with the body. We also know that when the information gets to the brain or how the brain is working needs to be efficient as well. So we know that the front of the brain needs to be developed, the back of the brain, the sides of the brain, right and left side. And what we're looking for, there's many different practices that do this, functional neurology, chiropractic, there's lots of people that do this. We're looking for one term is called hemisphericity. Is there a strength or weakness on the right and left side of the brain? If there is, we need to, instead of just taking both sides and kind of decreasing their function, we need to specifically target the weak area and stimulate its development. Is the front or the prefrontal cortex, front of the brain, is it weak or underdeveloped? And we know that there's things we can do to stimulate that.
Okay, back up. How would you know what part of the brain? Is it because different parts do different things, like the front of the brain is your short-term memory? So,
well, there's a lot of different tools that we do to assess that. But like we look at eye movements, we look at a lot of specific eye movements in particular, that correlate with different parts of the brain. We look at body movements, we look at body posturing, we look at distal muscle strength, so different sides of the body. If there's more strength on one side than the other, we know there's specific areas of the brain. We look at reflexes, primitive reflexes. So there's a lot of things that we do in the exam process to determine where the strengths and where the weaknesses are, if they exist, which most of the time with this population we do find some discrepancies there. And then we know that we have what's called neurological integrated movements to correct that. So like chiropractic, the chiropractic adjustment improves neural efficiency or brain-to-body connection, like improving nutrition and taking away inflammatory foods like gluten and dairy and food dyes and processed foods, improves that gut health and overall nutritional health of the body and the brain. Neurological integrated movements stimulate the weak areas of the brain so we can have a brain balancing.
So what kind of movements are we talking about? Lifting your arm up and down, or what?
There's a lot of different movements. It depends on where the weaknesses are. But for example, we have a lot of specific eye movements, convergence, saccade movements.
What are those?
Different eye movements that we do with the eye. So different charts that we have people follow, and depending on where their weaknesses are, near, far charts. Look far, look near, look far.
Oh, okay.
It just depends on what's going on. We do auditory. We use a metronome. To stimulate. So a metronome makes the sound, a beat, a tempo you have
like
to
the
follow.
tick-tock on a
Yep.
on a piano. Okay.
Yeah, like if you had piano lessons, we all had the metronome with piano lessons.
Right.
We use a lot of metronomes. We do balancing drills. We do different body movements. We do a lot of ball bouncing and catching. There's hundreds and hundreds of activities that we do, but the bottom line is we don't know which ones to do until we know where the strengths and weaknesses are, and then we do them in what we call our NIMS gym, our neurological integrated movements gym, with our NIMS coach, and then we put all of that together. So we have, and all of these separate modalities that we've just talked about in this three-legged stool all exist separately. What we've done in this focus program is we've put them together into one program under one roof so we can have maximum amount of improvement in the shortest amount of time and monitor it. And we're the only ones in the country who's done
So
that.
if you're, let's say if you're a senior.
Yeah.
And you're having some sort of issue, I'm trying to think of something a behavior that they could self-identify, that they might qualify for this type of program. What kind of things would an older person see happening that they would know that there's an issue?
Well, I think that a lot of seniors are recognizing that they have maybe had some of these issues
Right.
and had them forever, like attention deficit or ADHD, and so a lot of things, organization, memory. Big ones would be like obsessive compulsive tendencies.
Okay.
Those are comorbidities, we call them, of neurodevelopmental disorders, depression, OCD, Tourette's. These things are comorbidities. They tend to come
So
with.
that would be that type.
Yeah.
So you might have had something all along and never really knew it.
Right.
And then all of a sudden someone has said, oh, well, this is what your issue is. And at this point, you go, okay, now what? I'm 50, 60,
That's
65 years old. What's the point? But there is a point.
There is a point. And we have highly functioning individuals that are in their 60s in our program, improving. Going, I want to improve. I want my marriage to be better. I want to be, whatever their objectives are. And it's really cool to see them improve too, because their life and sitting down with them and their spouse or whatever the situation may be, and seeing how their life is changing, because they're addressing some of their weaknesses and not covering them up. We're not covering them up here with medications. We're helping them improve for life. And so if you could have one major takeaway from this discussion, it would be that if you or anybody suffers with a neurodevelopmental disorder, even if there's no diagnosis, because we don't need a diagnosis.
Right. You think there's
Right.
something going on.
Yeah. You have options. It's not, people are given really what we think are live with it and just keep on trucking.
Right.
Or use some sort of psychotropic medication. And there are some very serious consequences and side effects to both of those things.
Exactly.
And my mission in this community and in this country, because we take this out on a bigger scale here, is that people need to know that there are more options. There are more options. There are. Focus is a third option, and we've put things together. There are, we've taken 3 of the most successful modalities and put them together. So I'm pretty proud of that. I'm pretty excited about that. And we're seeing a lot of lights turn on with that. But the biggest thing is I want people to know that they are not dysfunctional. They are not bad. They are not stupid. There is something different about how their brain is working and how their body is working, and they can improve that. And so if there's, going back to one major takeaway, it's that be empowered. Know that there's information out there for you, and learn. Come learn about it. We do free informational meetings in our office every other week.
Okay, so if somebody wanted this kind of information, how would they get in contact with you?
Well, I own Spoelstra Family Chiropractic, and Focus is an offshoot. It is a program that we have. We built out the space next to us. They can call our office and get on our list. We have the informational meetings every other week. They're free. They're about an hour to an hour and a half. As you can tell, I have got a lot to talk about, so sometimes I go longer.
So give them your number.
Number is 208-667-7434. And our website is cdahealth.com. You can contact us. You can talk with our lovely staff, and they can put you on the list. Those meetings do fill up, so we do require that people RSVP and get on the list. And if that's full, we'll put you at the next one. That's why we have them every other week.
Very good. Well, thank you, Dr. Amy. I so appreciate you coming in and talking. Every time I talk to you, I learn something new.
Oh, good.
So it's been very enlightening. And again, if anybody has any questions, call Dr. Amy. Her office staff is fantastic. I know all of
Thank
them
you.
over there. And they can help you or answer any of your questions. So this has been the Senior Moment with Dr. Spoelstra. And this is Connie Clark with Home Helpers. And you have a very wonderful day.
Thanks for having me.